you guys today, really, truly among my colleagues. And I want us to think about this seminar more as a collaborative effort for us to think about what really are the guidelines that the profession needs to develop and abide by in the 21st century. How have things changed? And why is really important for us to acknowledge that the stress is really the other pandemic we are dealing with. Um, it is not surprise to you or to anybody else that we really find ourselves in the last decade with so very many major events, whether they're natural disasters or whether they are a move towards nationalism, the Black Lives Movement, the Me Too movement. There's really an awakening about some things that we've taken for granted and that we believe to be a particular way, which are being shaking inside out by this variety of events at the moment. So I think we are living a crucial time in our history. And it's not surprising that in the last decade, there has really been a significant rise to mental emotional distress. So I'm gonna back down for a moment here. And the statistics are really clear. We're gonna look at some of those statistics. But even though the growth of mental health crisis is really large across the globe, these numbers do not take into consideration the many people that suffer from emotional distress, and they don't really fit a category for a mental illness. I want to also say that, we have commodified mental health in a way that we have increased the diagnosis of human suffering so that we, as a collective humanity, can bill insurance, medicate people, et cetera, et cetera. And what I want us to consider is that human suffering does not really abide by these labels. And if you are interested in the topic, I invite you to get the book by Anne Harrington, who is the chair of the social medicine department, I believe, at Harvard Medical School. And she wrote this book, Mind Fixers, The Troubled History for Finding a Biology of Mental Illness, I believe. So you'll learn how is it that we came to talk about mental health as mental illnesses and have made big efforts. Again, when I say we, I'm talking us as a society, to try to be able to label people. So every time the diagnostic manual gets a new revamp edition, there's more diagnosis so that everybody can fit in, right? Because we can't figure out a way of just attending to human suffering without labeling people as being mentally ill. So what is the likelihood that whether or not you specialize on mental emotional disorders or even create space in your practice for these conditions, what is the likelihood that the patients that come to you seeking care will be suffering from emotional or mental distress? It's really pretty high. What is the likelihood that they will be taking some kind of psychotropic medication? Pretty high as well. And especially if you treat people with chronic pain or if you help people manage chronic conditions, these conditions are highly comorbid with mental emotional conditions, disorders, states, however we call them. And the spectrum goes anywhere from just, and I say just, mental distress to having a psychopathology. Doesn't really matter. We attend to the whole person when they walk into the room. So you can see here, and those of you who are not from the US, I'll have a couple of slides that are more global. It's a little challenging to find statistics, and I don't want to bore you with tons of statistics about all the different regions in the world. But just look at the United States in 2018. Also, the US is one of the countries with a very high incidence of mental health conditions that are diagnosed, maybe because they're diagnosed, and also the use of psychotropic medications really high. So we're just using this as an example. And note that this chart focuses on serious psychological distress. It's not talking about a mental illness, just serious psychological distress. You can see overall people 18 and over, and then broken down by 18 to 44, 45 to 64, 65 and over. So take a moment yourself, just a moment, to think about where in these 4 columns does your average population, patient population lies. What are the people that you see? Some of you may see more teens, younger people. Others may see more of the elderly people. How many of you see mostly women? How many of you see men and women? So you can make a note for yourselves, just so that you stay engaged with the material. So now if you look at mental health across the globe, right? And these are disorders. Any mental health disorder across the globe, this is the share of the population with mental health disorders. And this is the number of people, quite a few people. Keep in mind that if it's talking about mental health disorder, you assume that these people have gone through some kind of diagnosis. Just think about your average person in the world today. How many people have access to healthcare, and not to mention to mental health care to get a diagnosis? Now look at the difference between males and females. Is it really that females have more share of these conditions? Or is it that males have a harder time expressing how they feel? If you look at depression and anxiety disorders, probably some of the most common things you will see in clinical practice, you can see those numbers here as well. Pretty high. Still, it's always considered that women are twice as likely as men to manifest these conditions. In modern times, it's understood that men tend to cope with their depression and their anxiety, maybe by overworking, drinking, acting out in ways that you would not think they're depressed or anxious. Now, again, if you look at the US here just for a moment, right, and you can here look at the ages of people that are identified as having a mental illness. Now, if you look at 1 in 10 adolescents have experienced a major depressive disorder in the past year. If you look at the rate of suicide, about almost 3 million people out of the 9 million adults, that this comes from 2004, almost 3 million people have made suicide plans. About 1 million people have had an attempt that ended up being non-fatal. Not that many people get treatment for mental health conditions of any kind. And a top reason why young people have sought treatment primarily has been for depression, 30% of them because they were suicidal, and almost 30% of them because they felt afraid or they were tense. How many people use antidepressants globally? Look at this, it's like staggering. 2016. Now we top the chart if you live in the United States. Iceland comes close by. Korea and Chile seem to have less of this situation or problem going on. Look at the UK. Look at Germany, France. Wherever is it that you are, I should have taken a poll where you're from so I could make reference to your country of origin a little bit more readily. So it's our patience, it's our call, right? So your patients are likely to be on psychotropic meds. That's pretty likely. And they are likely to be on psychotropic meds. And if they suffer from chronic pain, they're likely to be on chronic pain medication as well. Our patients are going to tend to be functioning patients rather than being severely mentally ill. Probably, likely, if you are in private practice, depending on the settings where you tend to practice. So we are not going to manage a mental illness or their entire mental health in our practice, but we are going to be able to provide option to manage their symptoms. And I really believe that Chinese medicine practitioners need to position ourselves as part of the teams that are highly effective in the management of anxiety-related disorders and mood disorders. And we are not considered to be in that set of people that deal with these problems. We can potentially help augment the effect of the medications if they need to be on medication. That is, we can make the treatment more effective with less need for medication. We can help reduce the side effects of medication, and we can really help them engage in transformation and healing. So I'm going to begin with ethics. Why? Because ethics is at the core of safety. It is ethic guidelines that really provide the foundation for us to help keep our patients safe and to keep ourselves safe. This comes from Sun Tzu Miao, 7th century. It's probably one of the first accounts on ethical principles in Chinese medicine. And I'm going to read it slowly for us all. Whenever eminent physicians treat an illness, they must quiet the spirit and settle the will. They must be free of wants and desires, and they must first develop a heart full of great compassion and empathy. They must pledge to devote themselves completely to relieving the suffering of all sentient beings. Now I'm going to ask you to feel free to turn your camera off. We're going to just take a few minutes to center ourselves in our heart, just like we do when we first walk into a room with a patient. So I invite you to close your eyes and let yourself fully arrive at this moment. Let your breath bring you home to your body, to your heart, to your belly. And ground yourself in the present moment. And just ask yourself, why are you here? Other than maybe you needed CEUs in safety and ethics? And then listen to these words again. Whenever eminent physicians treat an illness, they must quiet the spirit and settle the will. They must be free of wants and desires. And they must first develop a heart full of great compassion and empathy. They must pledge to devote themselves completely to relieving the suffering of all sentient beings. Now allow the words to drop and stay just with the feeling of Sun Sun Miao's words. And just see what word or what phrase remains in your mind. And then take a deep breath through your nose. Inhale. Place your left hand over the space of your heart, acknowledging your experience, whatever it was. And as you exhale slowly, bring your hand down. Open your eyes and allow yourself to come back to the group, to the seminar, and turn your camera back on if you choose to.